So, Dr. Anjali, would you like to tell
Yes,
something how to prepare best for Neet PG?
sir. For Neet PG, the most important thing is practice, sir. That is the most important thing. One. Even after going through the notes, even after going through the lectures or videos, if you don't practice the question, nothing's gonna happen. So I read my notes, whichever platform that I use, whether it be Mero, whether it be Prep or anything, and I go through the questions. Like just reading it once does not help me. I go it multiple times, like at least try so that I can retain it. And one of the thing I do is, sir, I do previous year's questions, previous year's topic, focused on it more so that I know where to focus my time, energy, which one is a must read topic, which one is a can read topic, and which one can be left behind so that I can prepare my last few days reading those must know topic and can focus my time without wasting any time. I think that is one of the things that had helped me gain excess mark this time.
And which subjects to go with early preparation?
Sir, subject wise, I think every subject counts. Either one way or other. Nowadays, NEET is I think they are combining all the subjects together. So I cannot say that you can leave behind this subject and you have to focus only on this one. Yes, there are certain subjects like psychiatry, dharma, which you can read as a short subject, as different subject. But reading it, combining it with pathology, medicine, bagheera, it helps me retain little bit more than reading it as a short subject itself. So I think I read the big subject first, like surgery. I focus more on surgery, OBG, and pediatrics, so that as well as patho and micro. And then after that, I gradually move on from that. I think we should never miss out subjects would be FMT. So many questions usually come, attemptable questions usually come from FMT. Then OBG is like 20, 30. Whetes is so big in OBG and surgery. Medicine, since it is more or less combined with patho and micro, I think we can read medicine along with those subjects. And another thing is never leave short subjects. People sometimes leave short subject thinking, it's just one question, two question. But sometimes they are the one who would determine the rank of the candidate.
Okay. And about the material, which is the best and where to collect?
Sir, I cannot say which is the best because it depends on the person. For me, I have used Mero and Prep.
Right.
I I have been using Mero since last 4 or 5 years. So I know how the Mero's question pattern is and everything. For question, Mero is the best, I believe. And which there are certain subjects, like personally, there are things which a, a teacher is never a bad teacher. It's just that whether I am suitable for the teacher or not. So sometimes which I cannot understand in Mero, there are certain subjects which I would like to get uh, another teacher's lecture. So I take help from other sources as well. But other than that, I stick to one platform mostly.
Okay. Thank you so much, Anjali, for your guidance. This may help a lot many students, those who are aspired to be a doctor in
Yes,
go with the higher education like you. Okay. This is a good sign that you scored well and we are proud of you.
thank you, sir.
And Dr. Anjali, there are so many scope, like as you know, in our medical corps, you have to go with the first NEET PG exam only, entrance, then only you are allowed for an interview. Although
Yes,
this
sir.
rule was not before 4 years, this was
Yes.
rule was not there hardly 2, 3 years back. This started. Otherwise, we
This
have
is
been
the
teaching
same.
AMC, CAPF, UPSC, and we haven't seen such rule previously. There was no such
Yes,
rule.
sir.
Another job, one CAPF, Central Armed Police Force, ITBP, CAPF, MOSB. Their
Yes, sir.
intern students are also allowed. If you are doing interns, even then you can go with this job. That's a very good job. Recently, there was an interview in February, so I think it would come again in November or like this. So doctors can avail for that also. And there is no compulsion of any NEET PG entrance or anything. That is also a wonderful job. Then another
Yes.
we have GDMO, everybody knows. Then UPSC
Yes, sir.
CMS. There you are supposed to go with written exam. Many of my students are going to give now. And then they are supposed to give interview also. So in this way, there are different jobs. But in other organizations also, like All India, there is a job. In other or big organizations also, there is a medical officer job in most of the insurance sectors. Students are going. Okay.
Yes, sir.
But
Yes,
as
sir.
you stated very well points about NEET PG, that would definitely help many people. Okay, many
I think
aspirants,
it
and they
helped
would be
me.
thankful to you.
I think so.
And Dr. Anjali, you have studied with us. How is your experience with PD classes? कैसा रहा आपका experience हमारे साथ और हमारा
Sir,
suggestion?
I think I have gained confidence. I have learned how to speak properly, express myself more. That is one of the things that I have improved in the last few days. Sir, I am not a very good speaker. That much I was pretty sure before. It takes time for me to say what I want to say. Even though I know what to say, I can never express it fully in words. That one I have adapted my way of speaking so that I know how to speak. I know at what pace to speak. So I know now I am little more confident than before that okay, if I feel that I should speak a little faster, I need to think a little faster, or I need to slow down a little bit in order to think and give my answers. So I have little adapted to the situations because of it, sir.
Thank you so much for your testimonial also. We are proud of you. And now that Dr.
Yes, sir.
Anjali, we want your selection anyhow. Okay. You are our one of the
Yes,
best
sir.
student and we expect the best from you. Okay.
I hope for the best, sir.
And you listened our Brahmastar.
Yes, sir. I listened
So
to
how
it
was your
yesterday.
Brahmastar? कैसा लगा आपको?
I think it was very helpful, sir. It helped me calm down a bit yesterday. I was literally stressed out because, sir, to be honest, medical subjects are very vast. There's 19 subjects,
No
they can
end.
ask from anything, anywhere. There's no end. Even though I read for whole day, whole night, and if they ask something which I don't read, my confidence will be broken that very moment. I think the Brahmastra helped a lot to move on and then attempt the next one.
Right. Thank you so much for your appreciation for our Brahmastar also.